Hi, my name's Dave Thistle. I'm a sergeant with the Stoneham Police Department. I've been conducting investigations into domestic violence incidents for about 10 years, and I've been working with Respond for about the last 9. I'm here today to talk about strangulation and some other risk factors that we look at when we're investigating domestic violence crimes. 68% of women in domestic violence situations that are classified at high risk report having suffered a near fatal or non-fatal strangulation event. 38% of those women report that they've lost consciousness during that event. 35% of women report that they were strangled as part of a sexual assault that had occurred. 70% of women that were strangled report feeling or believing that they were going to die. And 34% of those strangulation events happened with women during their pregnancies, which is a very scary fact. Victims of a prior non-fatal strangulation are 750% more likely to be a victim of another attempted homicide, which a non-fatal strangulation is. A non-fatal is an attempted homicide. Victims of a prior non-fatal strangulation are 800% more likely to be a homicide victim. When you look at strangulation, when we're investigating somebody that's reported that they have been strangled or choked, as they commonly say, 50% of the time there are no external visible injuries. About 35% of the time there are injuries that you can see with the human eye that you can't document with photographic evidence. And then that leaves us with about 50% of the time where there are injuries externally that we can see and capture with pictures in order to present at court. One of the things that we always want to have done with somebody that reports that they've been strangled is to be seen at an emergency room or at a hospital, because you can have death occurring up to 72 hours post-strangulation event, because you're looking at a lot of swelling and bruising that occurs inside the throat, the larynx, that whole area of the body that we can't see, obviously, from the outside. And because of that, we want an evaluation done at the emergency room so a physician can document if there are injuries, if there are significant injuries, something that we can't see externally that we can use in court. And also to make sure, like I said, because of that swelling, that bruising that takes place, something that is, you can feel fine, 4 hours post-event, and 24 hours later you might be having difficulty breathing and it might be too late to be able to get you help at that point. So it's a very scary event when somebody reports that they have been strangled. When you look at strangulation, it takes between 4.5 pounds and 5.5 pounds to begin obstructing the flow of blood to the jugular vein and the carotid artery, respectively. When you look at the fact that it only takes about 20 pounds of pressure to open a can of soda, it's scary how little amount of pressure it takes to begin obstructing the flow of blood or the flow of air to the brain during a strangulation event. That's one of the risk factors. That's a very important risk factor that we look at in determining cases of high-risk domestic violence. And I hate having to say that we classify domestic violence as either high risk or non-high risk, but when you have to look at the sheer volume of cases that we're looking at, and if somebody's at a potential for being significantly injured or killed, there are a number of factors that have been studied and found to indicate that this person is at a high risk for potential homicide. Some of those factors based on your own beliefs, do you feel that that person is capable of killing you? Access to guns or firearms, having them in the home, is a huge predictor of potential homicide and domestic violence. That's not to say somebody who has firearms in the home is going to be is going to commit an act of homicide against their loved one, but when it's taken in conjunction with domestic violence, it increases the risk dramatically. Prior strangulation or choking, as is commonly reported, is a huge risk factor. The offender talking about committing homicide, the offender talking about committing suicide is a huge factor. A lot of times it'll be a homicide-suicide type of situation where if I can't have you, no one else can. They'll kill their loved one and then kill themselves. An escalation in violence or frequency of violence is a huge risk factor, and we usually see a lot of that in the first year that someone tries to leave a relationship. If someone is very jealous or controlling of who you see, if they try to prevent you from leaving, if they try and prevent you from calling for help, alcohol and drug abuse, And shockingly, violence towards animals is also a predictor of high-risk domestic violence situations. And forced sex is also, forced sex, rape, sexual assault with a person you're in a relationship with is also a high predictor of significant violence or potential homicide in a domestic violence situation. And when we look at people that have been killed by their loved ones, we see a large number of these factors were present that were either unreported or unrecognized. And now that we're doing a better job at looking at and recognizing these factors, we're trying to get these people the help that they need to get out of these dangerous situations. In Massachusetts alone last year, this current year, we had 14 victims of homicide that were classified as domestic violence. But when you look at that exponentially, you have a lot of people that are in these abusive situations that are self-medicating with prescribed or non-prescription narcotics. They have problems with alcohol as a part of coping mechanisms for their situation. And then you also have people that may just commit suicide on their own because they can't handle the day-to-day interactions of what their life is. So I think if you look at the numbers of intentional or unintentional overdoses as a result of self-medication, and also suicide attempts or suicide completed acts with a correlation with domestic violence, I think would see a significantly higher number. And that's why we have to recognize these symptoms of high-risk domestic violence when we see them, and provide the support that we need for the victims, and also work with the victims so we can hold the offenders accountable so that it doesn't become a repeating cycle with their next. If we're able to help one person leave a situation, we need to hold the offender accountable so that it doesn't keep perpetuating the cycle. Thank you.